Methodist Health System back in August of last year made a major investment into our neurosciences program by getting AI technology on our CT scanners. The AI technology that we use actually gives us an alert very rapidly that there is a concern with the patient's CT scan. This could be a head bleed, this could be a large vessel occlusion, and it allows us to diagnose the patient much faster. The AI does not take the place of the physician, however. It is alerting us that there is something abnormal on the scan, and it gets our doctors to review that scan faster so that we have that diagnosis and we can treat the patients faster. So it also allows us, there is actually a platform involved with this. So it's kind of multifactorial. First, it is a function of our CT scanner that is alerting us. But who is it alerting? It's actually alerting the entire stroke team. So anyone who is on call for, say, neurointerventional radiology, those physicians are notified. Anyone who's on call for our IR team, in the ED, the charge nurse, the neurotrauma ICU nurse, charge nurse, it is letting the stroke coordinator know. Myself, as the nurse manager of neurotrauma ICU, we are all alerted at the same time. And the reason why this is an important tool for us is that we are able to communicate on one specific platform that not only shows us what the AI was concerned about, but it also allows us all to receive the same messages at the same time. So if the physician has a concern and wants more information, that is usually the first thing that we do. We see this alert, we know that our doctors are reviewing it, but simultaneously the nurse is putting in information that the physician is going to want to know. And these are questions that we are very used to having to answer when we are trying to diagnose and treat these patients quickly. Millions of brain cells are dying every minute, and so every minute matters. The first thing that we are letting them know is that when was the patient last seen normal? How bad is their stroke scale currently? What is their baseline level of functioning? All of these things are going to assist us in making that decision of whether or not we're going to be proceeding with additional interventions, or if those interventions may be contraindicated for that patient. One example of how we have been able to utilize this technology to save our patients is in the early stages of our thrombectomy program. We had all developed our standard operating process of how we would communicate via the application. We knew what to expect from the scanner and how that would alert us, and the team was all logged on. We made sure everybody had access, and so we really were ready to hit the ground running. So I was awake, I was working out. Actually, I was on a treadmill. It was 5 o'clock in the morning, and I see a text, right? Comes up on my watch, and what do I see? That there is a rapid AI alert. At the same time, I'm slowing down on the treadmill, and I look down and I see that it's a 45-year-old female, which is really rare, very rare that I would see someone that young with a concern of this type. And so within minutes, I'm having to get down off the treadmill and take a look at all of this, because we are literally diagnosing this lady. The rapid AI alerted us that there was a concern on her CT angiogram. Almost within 1 minute, we had the interventional radiologist on there talking to us, asking questions about her last known normal, how bad her deficits were, if she took any blood thinners or other medications, and I know very quickly where this is headed, because it looks like this woman has a very significant occlusion in her brain. And sure enough, she met all of the criteria to take her to treat her, and we got her into interventional radiology and got that clot out of there, and did it very quickly. This woman came into the emergency room. She's a young mother of 4 kids. You think about life being so precious, and especially when minutes are mattering, us needing to move quickly. She came in, she was not able to talk at all. She had facial paralysis, drooping, what you would know it to be, and paralysis of one side of her body. And she discharged from the hospital less than 72 hours later. She was at her son's basketball game. So I don't know that I can really quantify how impactful artificial intelligence is for our program when you have results like that, because that really is showing you how it is helping us to treat our patients quicker and to save their life. So on a daily basis, I would say we're doing in the hundreds of CT scans between CT and CT angiography, trying to diagnose patients. Out of all the scans that we do, wouldn't you rather have this technology on your CT scanner as opposed to not?